Okay, thank you for the invitation. I'm Dr. Tomohiko Moriyama from Kyushu University Hospital, Fukuoka, Japan. It's my privilege to make a presentation in this AHC conference. I myself is gastrointestinal endoscopist and have been keen on remote medical education. So today I'd like to talk about our activities. As you know, colorectal cancer is a second and gastric cancer is a fourth leading cause of cancer deaths in the world. So the role of endoscopists is quite important to reduce cancer deaths. Japan is one of the highest area of GI cancers like this. Comparing to other countries, the incidence of GI cancer is quite high, but comparing to its incidence, the mortality is very low. Actually, most of GI cancer is detected at early stage and will be treated by minimal invasive therapy in Japan. Like this, early cancer can be treated by ESD or laparoscopic surgery. And nowadays, we can treat early pharyngeal cancer by ESD. Okay, why most of cancer is detected early stage in Japan? Because we have very good healthy checkup system with very cheap cost. It only take about $70 in one exam in our city to undergo endoscopic exam. And people can access to any healthcare providers. And the medical cost is same between a public and private hospital. It's very cheap. And comparing to the population, we have a lot of endoscopists and pathologists. And we can use new endoscopic modalities and equipment because most of endoscopic equipment company is Japanese one. And most important thing is education. For long years, we have shared knowledge and experience on endoscopy with colleagues and seniors. These are the Japanese major academic societies for endoscopies. As you can see, there are a lot. And each society have annual conferences. So in total, there are numerous number of conferences in a year. Through these conferences, we can learn a lot and also update our knowledge. But daily and continuous education is quite important. Through daily discussion, we learn a lot from our seniors and from our colleagues. All the endoscopic photo taken by young trainee will be checked by seniors and colleagues. And the quality of the images will be assessed. I will show one example. Do you know what a good photo is? No forms, no mucus, no residue, no camera shakes, and etc. I suppose these tips isn't noted on text, and no expert will explain such kind of tips. But we Japanese endoscopists learn these tips from seniors. And we got to know that gentle handling the scope is quite important for early detection. Then we can find such kind of subtle changes during endoscopic exam, like reddish color changes, abrupt change of vascularity, spontaneous bleeding, erosion, and something like that. To share the knowledge of Japanese endoscopists, we have invited and accepted many foreign doctors from all over the world. The left top photo shows the Egyptian doctor who trained in our university hospital last year. And also many Japanese experts go abroad to share the knowledge with foreign endoscopists. But do you think this kind of education is sustainable? On-site training is quite useful and important, but the time is quite limited, such as 1 month or a few weeks. And also travel expenses and accommodation fee is needed. And furthermore, very limited number of doctors can come to Japan and go abroad to share the knowledges. Unfortunately, this kind of on-site training is unsustainable. That's why we started our telemedicine activities around 2003. Sustainable education can be achieved by combination of telemedicine and on-site training. Okay, this is the movie of our teleconference, which was held 4 years ago.
Hi everyone, I'm Ho again.
Malaysian doctor.
Can I just check whether my co-chair Chai Chulalongkong?
Hello,
And
can
this
you
is
hear
the
us?
Thailand.
In this case,
And the
we
Japanese
carefully and
expert shows the
successfully
case
performed
here.
ESD considering his QOL after treatment. Marking dots were made 2 millimeters outside of the region.
Bye.
Okay, like this. I suppose you understand the usefulness of this kind of activity.
Hi everyone.
And I will show you the regular teleconferences. This is the oldest one with China. We discussed the gastric cancer cases with Chinese and Japanese endoscopists and pathologists. So far, we have held this conference more than 20 times. And we expanded this teleconference to Latin countries because Latin is one of the high-risk area for gastric cancer. At that time, a Japanese expert made a presentation for gastric cancer screening exam. And in 2018, we started the teleconference with Russia like this. From western part to eastern part of Russia, many medical institutes joined this teleconference and have some discussion on the interesting cases presented from Russian side. This is a photo taken last year. This teleconference is the largest one connecting many Asian institutes. At that time, Dr. Ayman Sakar joined this conference from our university hospital, and Dr. Mohammed Al-Raye kindly joined this conference from Egypt. We have enjoyed fruitful discussion on interesting cases. Okay, these are the feedbacks from participants. Image resolution, image movement, sound quality, and program is very highly evaluated like this. And now we expand our teleconference activity on US. Same as the last one, Dr. Ayman joined this conference from our university hospital. Now, many Asian institutes from Thailand, Myanmar, Malaysia, Taiwan, and Vietnam joined this conference. We have held this teleconference more than 10 times. Okay. Knowledge and experience is very important for medical doctors, but for endoscopists, technique is also very important. In Japan, we train our technique using animal models and simulators like this. But in real practice, avoiding unnecessary bleeding is very important for ESD. So I'd like to show the tips using video. In incision, better to do shallow incision like this. Then the large vessel beneath the surface will be exposed like this. We can coagulate these large vessels using forceps before deeper incision to submucosal layer. And next is the tips for dissection. If you go to the upper part of submucosal layer, there should be many vessels like this. So you should always do a coagulation procedure during endoscopic, during ESD. But once you go lower part of submucosal layer, the number of the vessel is very limited. So it is better to go just above the musculus propria for gastric ESD. These kind of tips and tricks can be learned from the procedure of experts. That's why live demo is quite important. This live demo was held in 2017 at APDW. At that time, we technically supported this event. We connected many Asian institutes to the venue, and Asian experts showed their endoscopy technique from their own hospital like this. They are quite comfortable because they can do their procedure as they do in their daily clinical practice. And also participants can enjoy their technique at the main venue. And at that time, a lot of preparation and effort is needed to achieve such kind of big event. But under this COVID-19 situation, telecommunication system is dramatically improved. That's why we can do this live demo using
Professor
Zoom, like this
Saito,
webinar.
who is head of the endoscopy
At that
department
time,
with
Japanese
the
Institute,
Tokyo-based
National Cancer Center is connected to Russian Institute.
Okay. Good morning, good afternoon.
And Japanese experts show
Sensei and everyone.
chronic
Okay.
ESD
The region
from
size is
their
about 2
endoscopic
centimeters
room.
or less, but located in the sigmoid column. There 2A plus 2CD.
Перевести.
Using
Professor
telecommunication
Saito, do
system,
you
participants
see
can
already
ask
fibrosis
the tips
on the lesion
and
or not yet?
techniques directly.
Yeah, we already
To
encountered fibrosis. Yes.
Добрый день. Теперь мы...
Okay. So far, we have held such kind of teleconference more than around 1,000 to 400 times with more than 1,000 institutions in 80 countries. And nowadays, we can learn and share the experience, knowledges, and techniques by telemedicine. This is a summary of my presentation. Effective and sustainable medical education can be achieved by combination of on-site and online education. We can share knowledges, experiences, and techniques on endoscopy via telemedicine, even in the COVID-19 era. Telemedicine plays an important role to reduce health inequality within and among countries. Okay, this is the last slide. Okay, if you are interested in our telemedicine activity and would like to join us, please visit our website. Please find TEMDEC. And we also have Facebook account and the YouTube channel. Do not hesitate to contact us. We are more than happy to collaborate with you and support your telemedicine activity. Thank you for your attention.